I was in my third year of dental school, about to start surgical extraction of my first wisdom tooth when I felt a man behind me. He pressed his body into mine, and his arm circled around me. His hand took hold of my hand that was holding the surgical blade. I slowed my breathing and finished the surgery and said nothing. The man behind me was an oral surgery resident, and I feared if I complained, he and the other oral surgeons would retaliate and block my applications to oral surgery residencies. After that incident, I thought long and hard about whether I wanted to pursue my dream of becoming an oral surgeon. Did I really want to work in an all-male dominated field? Did I really want to put up with the harassment and the discrimination? Did I have any idea of just how hard it was going to be? No, but I decided I wanted to be an oral surgeon, so I persisted. Despite the unequal treatment with the 5 other dental students that were interested in oral surgery, they were allowed to take overnight call with the residents and spend time in their office. I was not. I couldn't change their behavior, but what I could do was work hard and prove that I was good enough to be accepted into an oral surgery program. I found a local oral surgeon who allowed me to spend time in his office and in the hospital with him, and I completed an internship with the Navy oral surgery program. I was offered multiple interviews. In one of the interviews, I was just told that I was filling a mandate, that they had no interest in actually accepting a woman. At another program, I had a senior oral surgery resident guarantee me he could get me into his program if I spent the night with him. And despite discrimination laws, every one of the interviews I was asked, was I married? Was I planning to get married? Did I have children? Was I planning to have children? And what would I do if I got pregnant? The men were not asked these questions. I matched an oral surgery program at the Hospital St. Raphael with Yale New Haven Hospital, and the photograph you see is me operating with my program director. The discrimination and the harassment continued during my 4 years of residency, and it continued in the 9 years that I served as a board-certified oral and maxillofacial surgeon and a commander in the United States Navy. And it has continued in the almost 4 years that I've been in private practice. You see, women in healthcare, and specifically women in surgical specialties, we were taught to be thankful that we were allowed into the good old boys club. And we had to constantly prove that we were tough enough. We were assumed a liability until we could prove otherwise. According to a 2018 report, the National Academies of Science, Engineering, and Medicine, 80% of medical students have reported sexual harassment. In academic medicine, 70% of women have reported sexual harassment. Despite the fact that both medical and dental schools are now 50% men and women, only 37.6% of women make up the American College of Surgeons, and only 8% of the American Association of Oral and Maxillofacial Surgeons are women. Why are there so few women in the surgical specialties? Well, the women I knew didn't think of it as an option, or they didn't want to put up with the harassment and discrimination, or they didn't want to be told they'd have to delay starting a family. When I started my program, I was told I was not allowed to have children until I finished my program, which meant that I was 31 years old starting a family. I still, to this day, almost 13 years after finishing my oral surgery residency, have people say to me, "You are the first female oral surgeon I have ever heard of." While women make up over 80% of the healthcare workforce, the decision makers, including the hospital leadership, executives, and presidents, are largely men. So how do we attract more women into the surgical specialties? And how do we support them so that they can be successful, to be our decision makers and leaders? Things aren't going to change unless there's a call to action. We need more women in the surgical specialties. First, we need mentors. Those of us that have shattered the glass ceilings and broken down barriers need to lead the way. Second, we have to implement sustainable family planning and childcare. Lastly, we have to end the gender discrimination, sexual harassment, assault, and bullying. As I mentioned earlier, 37.6% of the American College of Surgeons are women, while only 8% of the American Association of Oral and Maxillofacial Surgeons are women. Even though both medical and dental schools are 50% men and women. Our medical colleagues have done a better job of supporting and mentoring women into and through the surgical specialties. One of the ways that they have done this is in 1981, they established the Association of Women Surgeons. This is to engage, empower, support, and mentor women from medical school through retirement. Women like myself have to give back to our professions and work to support other women. Medical centers typically do not have sufficient policies for pregnancy and childcare, making it difficult for women to balance motherhood and work. When I was 28 weeks pregnant with twins, I developed severe anemia. I had trouble walking up a flight of stairs, and I couldn't stand to operate for more than an hour. I was put on modified bed rest and half days of work. This allowed me to continue working until the day I delivered twins, healthy at 35 weeks. Thank you. Any woman that has ever been pregnant or delivered a child will tell you that it's challenging, and they call it labor and delivery for a reason. There have to be policies in the workplace for pregnant healthcare providers that will allow flexibility of hours for appointments, complications, and basic needs like nutrition, hydration, and rest so that they can deliver healthy babies like their patients. How many women do you know that were career women that decided to stay home once they had children because childcare is so expensive? Our twins were born while we were living in San Diego, and there were no openings in any childcare facilities for 2 newborns. We had to borrow money and hire a nanny so that I could return to work at my 8 weeks postpartum. Even once we got them into childcare, the hours were not conducive to my surgical hours, and we still had to hire babysitters and nannies. I remember an especially hard time when my husband was deployed and my nanny called out sick one morning. My male colleague told me to put out a bowl of water and food and get to work. He wasn't joking. We need family-friendly policies with paid maternity and child-rearing leave, regardless of gender, sexual orientation, or adoption status for all new parents. We've got to have lactation rooms and on-site childcare services with emergency backup care. And we have to have better career flexibility and control of our schedules with flex times and ability to telecommute. The story that I shared at the beginning is just one of many that I've experienced. But it wasn't until the MeToo movement that I realized just how many other women had experienced similar situations and had finally found their voice and were standing up and saying, "No more." I found my voice when Time's Up launched as a response to the MeToo movement. And in February 2019, Time's Up Healthcare launched, and I decided to share my story. I was selected to run the New York City Marathon this fall to support Time's Up and raise awareness for its mission, to have every healthcare facility sign a pledge to end discrimination and harassment. Now, research shows that workplace discrimination against women physicians and surgeons is common. Women are paid less. We're disrespected by our colleagues. We're held to higher standards than our male peers. We're often addressed less formally, for instance, by our first names instead of our professional titles. And we're often not invited to speak at major events like talks and panels. In June 2019, Dr. Francis Collins, the director of the National Institutes of Health, issued this statement on helping to end the all-male panel. He said, "Ending the mantle begins at the top. Starting now, I expect a level playing field at public speaking events with a diversity of ideas, or I will decline to participate, and I challenge other leaders to do the same. We need more leaders like Dr. Collins that are committed to ending the discrimination and the bias against women. In an October 2019 study by the American College of Surgeons, it found that 78% of female surgeons have experienced gender-based discrimination. It also found that 90% of the men that responded did not feel that gender discrimination or sexual harassment were real issues. The author of the study, Dr. Gallagher, explained it. We found animosity towards the discussion of sexual harassment and aggrieved entitlement. Michael Kimmel coined this term, aggrieved entitlement, in his 2013 book, Angry White Men, to help describe this, some men's defensiveness and anger that they felt that their rights were being taken away. Of course, some may claim that these women are being overly sensitive, but a recent New England Journal of Medicine study found that medical residents that experience harassment or discrimination were 194% more likely to have burnout symptoms and 207% more likely to have suicidal thoughts. The most potent predictor of sexual harassment is organizational climate. The degree to which those in the organization perceive that sexual harassment is or is not tolerated. How are those of us in healthcare supposed to adequately care for our patients when our own colleagues This broken glass window with XX was made for me as a gift from my sister-in-law, and it represents vitreous fractus, which is Latin for broken glass. It's the name of my LLC. It's now in the wall between my private office and the main hallway in my practice, Knoxville Center for Oral and Maxillofacial Surgery. And it's a daily reminder to me of the glass ceiling that I have shattered and all the work that still needs to be done. Thank you.